Hi everyone, I'm Dr. Faisel Syed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Faisel and Friends is brought to you by Primary Care for America, a diverse collaboration of innovators leading the way towards comprehensive, continuous, and coordinated primary care.
Today we're talking to Bergen, Morehouse, and Mahima Sangtani from HOSA, Future Healthcare Professionals, about fostering a sustainable workforce. Let's get started. Hello, Dr. Dan.
Hey, Faisel.
Welcome. Bergen Morehouse, Executive Director of HOSA.
Thank you so much for having me.
And Mahima Sangtani, third-year medical student.
Yep, happy to be here. Thank you so much.
Thank you both for being here. You know, one of the things that Dr. Dan and I are so fortunate that we get to spend so much time with students and residents, you know. So for people who don't fully understand HOSA, we can get started. What exactly is HOSA and why does it matter so much for the future of healthcare in the country?
Yeah, absolutely. Well, thank you again for having us. We're honored to be part of this conversation today. So if you haven't heard about HOSA, HOSA is Future Health Professionals, and we are what's called a career and technical student organization. So we really try to empower young people to become leaders in the global health community, right? We have members as young as middle school students, actually, high school students, and post-secondary collegiate. And we are very much part of the curriculum. So inside the health science classrooms, and we promote career exploration. It's all about education, exploring careers in health, learning some basic techniques and skills related to somebody's field of interest. But really, it's also about teaching our HOSA members those durable skills, the leadership, the teamwork, the communication skills, anything. They're going to be well served by those in any career, but, especially when we start talking primary care careers, those values that we're teaching in HOSA really, I think, resonate and translate well into the primary care workforce.
Could you share a little bit just about the numbers, like how much has HOSA grown?
Yeah, absolutely. We actually are a membership of over 370,000 young people, and that grows annually, which is really exciting. When you look at that, we're in nearly 7,000 different classrooms across all 50 states, and we actually are international too. So we have membership in Puerto Rico, American Samoa, Canada, even China and Korea now. So we are truly an international organization. We're actually celebrating our 50th anniversary this year. So we have, a legacy that we stand on, and we think that there's, close to 4 million alumni out there that are former HOSA members that are hopefully a lot of them practicing, hopefully a lot of them in primary care. So good data.
Now, one thing I saw is that before you became the executive director, you were leading the competitive events. So I don't know. I see 10th graders trying to sew up pig's feet or something like that. What are your competitive events that you have for these people interested in healthcare?
Sure. I love that you found that, because our competitive event, or our CE program within HOSA, is really kind of one tool in our tool belt, so to speak, that really helps excite our students and engage our young people to learn about health careers. And we have over 100 different competitive events now, and they vary. So it's everything from intro physical therapy, intro nursing assisting, medical assisting type skills, but it's also the, project based, where they're learning that teamwork and communication and how to present in front of a group and the public speaking. And so it's really kind of that carrot for our students. They have the opportunity to practice these skills throughout the year and actually compete against other HOSA members at local conferences, state conferences, and our international conference, which is kind of the culmination of those experiences in competition. So it's a really fun way. They get excited. They're very excited to be on stage at the end of the conference, have a chance to earn a medal for showcasing their skills in competition. So
what kind of jobs, what kind of careers are the students mostly interested in these days? There's been so much disruption.
Yeah, no, that's a good question. We do a little bit of surveying of our members, and actually about 30% of them are interested in medicine. And so, in this context, that's, I think, really exciting, because we've got, over 100,000 young people every year that want to go into medicine. And, how can we kind of shape some of those conversations and bring in partners like AAFP, which has been a tremendous partner of ours, to really, tell our young people about primary care and how they can be part of that, when they go on to careers.
Dr. Dan and I were in a workshop yesterday talking about, the need to do a lot in healthcare, of course. And one of the key points was doubling the amount of primary care residents from where we are right now, and also doubling, quite frankly, doubling the workforce itself. And I think it's incredibly short-sighted to not go further. We gotta get them as soon as possible to inspire them, because that's what I feel like with the younger generation now. My oldest son is a senior.
Okay.
He's graduating from high school and going to USF. He doesn't want to do healthcare. He wants to do finance, but I don't hold it against him.
Right, right.
But I see it in him and his friends, like how they're entering this world much less naive than I was. I remember leaving my small town and getting out into the world not knowing. They know so much more about burnout across industries, like just systems being overwhelmed, everything with COVID and all that. And despite all that, they still want to get out there and serve humanity. And they wanted to, that says something incredibly powerful about this generation, especially compared to mine.
Yeah, I just love that because I think I'm very spoiled in my job and everyone that encounters the HOSA organization, because you're very inspired about the next generation, and students like Mahima, who's here, on with us today. We're very hopeful about what's coming in the pipeline, and our HOSA students, they really want to make a difference. They're mission driven. They want to make an impact, and I think the values and things in the primary care space really resonate with our HOSA members, because you can tell that story about how they can make an impact across a patient's, life. And so I agree. I just think we're in a really hopeful space, and it's really a privilege to be able to work with young people right now.
Mahima, I mean, Faisel was talking about the young people, and we have one of the young people with us, so we should hear your story. And I know you're interested in family medicine. Tell us how you got involved with HOSA and how that impacted your decision to enter medicine as a career and to think about family medicine as a specialty.
It's been a long journey to get into it, but it started really young. Actually, I was in middle school and I was already had this interest with the human body because my mom made a career change from business into healthcare informatics. So she was dreading human anatomy, I think, for the 4 months she had to take it, but I loved it and I helped her teach it. And she ended up doing well in that class. But I realized in the back of my mind, I wanted to do something in the human body, something in science. And then one of my friends in high school reached out to me. She's like, hey, I'm going to do this event in HOSA. And I had no idea this club even existed. And I was like, okay, what's it about? So I ended up doing a competitive event that we just talked about. There's so many options. I got to do cert skills. We learned about a disaster preparedness and response. So it was my first exposure into like the clinical knowledge needed for medicine. And when I was setting up for that event, we had it's like a multiple choice test to start off with. And then you actually have clinical based scenarios that they test you on when you're at the state conference. The big takeaway I actually got from that was I realized I actually had a big intellectual curiosity into medicine. And that was just kept in the back of my mind. And I also felt like beyond just knowing the foundational knowledge, there's so much, as you mentioned, so much team-based learning involved, so much communication involved, problem solving beyond just knowing things about medicine. And HOSA gives the perfect opportunity to apply those things at a really young age and see if you have that interest in it.
I would love to hear it from you. What are some of the misconceptions that people like me, the older healthcare people, have with the younger generation?
Misconceptions? I don't know. I feel like this is actually a conversation I commonly have at the dinner table with my parents because we have that generational gap. I think it's often that maybe some of the older people can think we're lazy, but I think we kind of have, I don't think it's lazy. We have all these outside things we want to do outside of medicine or outside of our jobs. And I think some people older than us view that as that we don't have that passion. We don't want to be working all the time. But I think people in my generation, we've started to realize that we need to have that balance early on. And that speaks to the fact of burnout that you were saying from the beginning. I think the people in our generation know, we need to set time aside for ourselves outside of just our careers. And I think that's going to help us in the long run.
I agree so much with that, because in my generation, it's okay, how can we build a healthcare system? But we lost ourselves in the process. And your generation is hey, how can we build a better healthcare delivery system without losing ourselves or our families in the process. I find that incredibly inspirational.
The Pit is the show about the emergency room right now, and there's a medical student in there, and I mean, it's just one scene, but it gets to the end of the 12-hour day, and somebody asked her, said, "Can you do this?" And she's like, "No, my shift's over. I'm leaving. I'm going home." And I think there's been a lot of discussion around the generational idea about that. Is it okay to leave? But at some point, you generally get treated the way you allow yourself to be treated. So learning to set boundaries is important.
I definitely agree.
I know HOSA has done a lot of work with helping with the students with all the technical. There's a lot of technical skills, but so much of the relationship, with like the leadership, empathy, how to communicate, how to connect with people. Like, do students still crave these types of relationships, like this type of a relationship between a healthcare person and a patient?
Yeah, I definitely see. I'll let you jump in then too. We definitely see that. And I think too, I mean, it really, you ask, I think, former HOSA members, others that are alumni out there that, yes, I think they remember some of those technical and clinical, skills and experiences, but it really, most of the time it comes back to, but it's because of HOSA that I learned how to communicate, and I learned about empathy, and, how to sit across the table from somebody and be a normal human and see how can I serve you and how can I help you in this situation. So we see that a lot with our alumni who come out of the program.
I definitely agree that was my first exposure. And I know it was technically, we had mannequins in the room that we were practicing on, but it felt very real, because it's like you're finally placed in more of like a high pressure situation. You're responsible for that person. And it's like your first time actually shifting your perspective and being that first responder in that situation and getting that exposure really early on.
There's so much misinformation, right? We've never had access to so much information, and even with all the great AI tools and everything that's all available right now, it's so quick to, push up zebra diagnoses, these very rare things, and for those of us who've had loving mothers, we've been all raised to think that we're these unicorns, right? And but most of us are horses. And so much of the suffering that happens right now in hospitals and emergency rooms are people who just need to be seen. They just need to be heard, and it's tough. It's a tough thing for many of us in healthcare, because we want to get right to the medical crux of it all. But like, sometimes the most therapeutic thing we can do is just be there and listen to somebody. And
Yeah.
primary care is built around that.
Absolutely. And I think the outcomes, come as a result, right? When you can have those conversations and listen to what's really going on. Maybe the patient presented with, X symptoms, but then you sit and have that conversation. Oh, this is what's happening at home. Or this is why I'm missing my appointments. I don't have transportation, or I'm, taking care of my aging mother at the same time. All those things that play into it, right? I think it's only through those kinds of conversations that you can really, really find out the true and the full picture, I guess, when you're seeing somebody like that.
I know as a medical student, at least I take advantage of the time that we have, like when we're on our rotations out in the clinic, that we get all the time in the world to talk to our patients. So you learn so many things about social determinants of health. I'm actually currently on my family medicine rotation right now. So
there you go.
And I'm just enjoying all the ways that I think half the time patients, there may not be there for that specific complaint or concern they're there for. They're actually just here. They just want to talk about their day or talk about maybe what's kind of stressing their life. And that makes them feel better when they wrap up the visit.
Yeah.
You probably find yourself walking through their lives with them.
Mm-hmm. Exactly. The continuity of care, which is really nice. You get to see them throughout all that stages of life, which is really great to see in the primary care setting.
You're probably not like this, but a lot of times students are afraid to ask questions because they don't want to be considered that they're not smart. Well, patients have the same thing going on. So sometimes it's hard to figure out how to draw it out and actually hear what they're telling you. One of my mentors would talk about the thing that always gets you. You've had the entire visit, you spent 20 or 30 minutes, you've got your hand on the door and you're getting ready to walk out. And they say, by the way, and then, that's the big thing. That's the big thing. So, yeah. So what did you learn in HOSA that has turned up as an advantage in your clinical rotations maybe unexpectedly, that you didn't think you learned this, but you did, it's something popped up. Yeah, I learned that there, and other people didn't know it.
I think it was more the way to talk to patients and the way you should be wording questions so you can get the most information out of them in that moment. Sometimes when we use like technical jargon or the words we learn in the textbooks, that's not exactly what patients know. Like they don't know that terminology. So I think all that practice I had in those competitive events for HOSA, I learned how to ask questions in layman's terms. And I think that's something I realized really actually early in my pre-clerkship, like my first 2 years where we do those practice interactions, that I'm like, well, I'm a little bit of a step ahead here. I don't need to spend as much time on the patient communication side.
Yeah, as somebody once told me, if you listen to the patient long enough, they'll tell you what's wrong, but they don't read the medical textbook. So they're not going to tell it to you in medical jargon. You're going to have to figure out how to put it together. Yeah.
Exactly.
And one thing I loved hearing about Mahima, about your story, is that you said it was in high school, right? It was your first exposure. Early, right?
Definitely early.
Yeah, early. And I always think about that. I mean, to your point, Dr. Faisel, about expanding residencies and all of those things are so important. But then you hear stories like this, and it's that exposure earlier and earlier. And maybe that decision didn't get made, in that moment. But there's so many people that have a story like that, where they're, somebody went through some kind of health experience that really made them know or want to pursue health. And so having these conversations earlier and earlier, I think, is just a really key part of what we're doing to build that healthcare workforce pipeline.
Yeah, I love, Mahima, hearing about how your HOSA experiences helped kind of it shaped your confidence with how to ask questions, us getting in the way of ourselves by speaking in too much of a technical way, right? Speaking in a relatable way. I really love that. But why family medicine?
Oh, that's a great question. I actually, really interestingly, when I came into medical school, I was thinking surgery for the longest time, like the high pressure, the high stakes. That's what that competitive event I did, Cert Skills, really, I thought that was it for me. I thought it was going to be that. But I realized actually on my surgery rotation just a few months ago that you don't get as much of the patient interaction, like talking to them about their day and you're more on the procedural side of things. That quickly hands-on, more procedural side, and I didn't really like that as much, and I didn't really enjoy the energy of the faculty that I was working with. But family medicine, it's so different. I just loved how we get to continue to see them throughout all stages of their life. We can take care of their relatives. We can take care of all ages, and you still get a little bit of the procedural focus as well. So I really enjoy doing sports medicine. That's actually something I'm interested in. So I love getting a little bit of everything, getting chronic disease management, continuity of care, and then getting the procedural stuff. So you get a little bit of everything. And I think one of the biggest hints that I was like, it's going to be family medicine. I loved everything. And then I got to family medicine at the end, and I was like, okay, I think this is the one.
Oh, I love that.
I love it. I love hearing that. It still is. I would just say that out of all the different routes that you can go, it's definitely one of the purest expressions of just, the relationship-based medicine that you definitely did not feel in surgery.
Yep, I definitely agree.
Yeah. I mean, you become part of the patient's lives, their families, their entire generations, and still outside of some of the bigger cities, but in most of the country, like in the communities, the family doctor is still like the pillar of the communities.
And yeah, we're the first people who they come to see us, and we're the ones who are sending them on to like the next stage, like whether it's a specialist, whether it's to the ED, we're often the first ones responding to whatever concern that they have. So
I remember, to your point about, kind of being the pillar in the communities, I was, a young newlywed, and my husband and I moved to this tiny little rural town in Montana of 4,000 people. And I had this amazing, like from a patient perspective, experience with a family medicine doc. And, he took care of me, as a young adult for 4 to 5 years and helped with fertility issues as we wanted to start a family. And then through my pregnancy and delivered my son. And then, was our pediatrician, when Liam was born, and my husband's provider. And there's just something amazing about being part of a community and knowing that your healthcare provider is in that community with you, and you see them at the grocery store, and it's part of the whole health of the family. And I think just being able to share that message with our HOSA members and obviously, other students that are out there trying trying to consider what route they want to go. I just think there's something really powerful in that story and in that messaging.
Yeah. I mean, it's so refreshing to hear that. I mean, we love hearing these stories about the doctor taking care of the wife, the husband, the baby, and being and maintaining that relationship. We just love it. It's a beautiful thing about family medicine. But, Mahima, this time that we're living in right now, we're seeing so much change in healthcare, and you're seeing it now in your rotations. There's a lot of things that are breaking, the old stuff, and a lot of transformation happening. I remember it was last year we were talking about the role of AI in and the AI tools in clinical rotations. And some of the hospitals were like, no, we're not gonna. This is that we can't let any of this happen. And it was too late. It was already there. Even with telemedicine, telemedicine because of COVID, the way that during COVID, telemedicine, just the idea of having an entire team working with the doctor. When I finished residency, it was just one person that we were lucky to have one medical assistant. Then of course things started growing with team-based care, but there was just so much. So we're just in a wild time right now. For you, from your perspective right now in your clinical rotation, what kind of healthcare system do you, like, as the next generation, do you want to build?
I think I like to think about more of like the AI side of things, actually. I do see a lot of benefit with using AI. I don't think I would want it personally as someone who's learning medicine right now. I feel like that's where you should be kind of doing more of that self-learning and not relying on these tools and becoming dependent on them. But I feel like it can serve a really good purpose and more of a supplementation when you're already a practicing physician. So I can see it to help reduce like charting, documentation, scribing. And I believe actually one of the leading things for burnout, again, is all those my chart messages you get and all those in-basket messages that you get. So I think AI can help in that fact. And also it can help in terms of staffing, especially in areas that don't have as much of that. There's medical, like supplemental personnel, like medical assistants, nurses, scribes. If they don't have that, AI can be another really great tool to have in the background to help basically run a clinic or run a system that doesn't have that much support.
When I was a resident, the little pocket calculators the size of a credit card, that was high tech then. But there were a lot of things that we've sort of lost through the years, because I can remember learning some of the pediatric antibiotics, and the attendings would say, well, this size is a 125 dose of amoxicillin, and this, once they get to this size, you go up to 250, and that's all you really need to know. And so once you got used to it, you just started doing that. You sort of learned just based on size, this was the way you ran IV fluids. You didn't do the massive calculation that I'm sure is done now, because AI will do it for you. So it'll tell you exactly how many cc's per hour you need. But we would sort of, this was 50 cc's, this was 75 cc's, and this size was 125 cc's or something. So it is pretty cool to have seen that evolution over time. David Slauson has written a lot of the articles about information mastery, and one of his analogies is every doctor, it's like we have a bread store. Well, the first thing you have to do when you're a student, you have to fill the shelves with the information, and you have to have a place to sort of pegs to put it all on. And then once you have all that information, then you have to be sort of surveying what's going on. When is this piece of bread getting stale and I need to throw it out, right? And when do I get another one? I mean, when I was a medical student, we would have never given anybody anticoagulation with acute coronary syndrome, because we thought that they've had an infarct, and if we anticoagulate them, they're going to bleed into the infarct, and that's going to make the infarct larger. Now, how many people died because we got that wrong, I don't know, but it was a significant number. That was a piece of bread that's stale and needs to be replaced. And the information's coming around so much faster now than it used to be. So I think it's an exciting time, but figure out how much of it needs to be up here and how much of it needs to be in the cloud somewhere is going to be an interesting problem that your generation is going to have to solve.
Yep. And I think that's where AI can help a lot, because it will give you a lot of the information that maybe you're not keeping up in your head in that moment. You can quickly do it. You can do a research on it. But then the really good thing is this is where like your your education is really important, because you need to be able to appraise, you need to be able to evaluate that the information they're giving you, is it clinically accurate. So that's where I do appreciate like AI resources that provide the references that they're using to answer the question, so that I can look into that stuff and see is the resources they're using something that I think is good enough and accurate enough for me to apply it to the patient I'm seeing at that time.
Absolutely. I think those things are, we've been so fortunate that and within a couple decades, we've seen all these advancements with the technology, but there's some parts of medicine that are never going to change, like that presence, right? Like my doctor knows me. My doctor took the time to understand me. My doctor sees me as a human being, like person to person. That you can never replace with AI.
We like to say the human first skills, right? All of those things that hopefully would be a lot harder to replace by AI. Yeah, I couldn't agree more.
For Mahima, I got one last question for you. I love students. Obviously, we love students, and we probably need to bring more students, and it's probably time for us to attend another national conference. That's when Dr. Dan and I both get re-energized. It's just so refreshing to hear your perspective, and I love that about young students, and especially ones going to family medicine. You just finished in the last stage of your family medicine rotation. As everyone's talking about the future of healthcare, what gives you the most hope right now at this time? You just finished your family medicine rotation. You want to do it as residency. What gives you the most hope at this stage of your career?
The people in family medicine. Actually, that's been the biggest driver this whole time. Exactly what people in HOSA like you, Bergen, and all these programs, like the big thing that makes an impact of people going into primary care is that early exposure. So for me, it was very similar. During my first year of medical school, the first club I joined was actually family medicine, because I didn't know exactly what I wanted to do, but it was the faculty that I met. They were just so welcoming, and they were so open to inviting students, teaching students, and also just showing that there's so much breadth in family medicine that I was kind of hooked really on in my medical school education. And that's kind of what planted the seeds like really early on.
That's one of the things we're really trying to do with our partnership with AAFP is highlight like exactly what you just said to all of the hundreds of thousands of HOSA members and beyond about that story and the people and being able to make a difference like that. We just hope we can keep telling that story and influencing more people to come your way, primary care.
Wow. Well, thank you both for taking the time to join us today. It feels so refreshing. Thank you both for reminding us that the future of medicine, still gives us hope. Thank you so much. And thank you for anyone listening. Thank you for joining us today.
Thank you. It was a pleasure.
Thank you for having me on. Thank you.
What are your thoughts on fostering a sustainable workforce? You've heard ours. Now we want to hear yours.
Email us at faiselandfriends@gmail.com, and your question could be featured on the podcast.
If you like this episode, leave us a review and tell us how we're doing. And don't forget to subscribe wherever you listen to podcasts so you never miss an episode.
Connect with us on social media by following Faisel and Friends.
And follow Primary Care for America on LinkedIn and Twitter.
I'm Dr. Faisel.
And I'm Dr. Dan.
And thanks for listening. This podcast is brought to you by Primary Care for America Collaborative and produced by Split Prism Productions.